This is USVI News, your Virgin Islands connection.
Hi everyone, thanks for joining us for USVI News. I'm Emily Matson in this week for Brissa Bradfield. We begin in St. Croix, where VIPD are investigating the brazen armed robbery of an elderly woman inside her home. It happened Sunday around 3 o'clock in the morning in Castleburg. An 80-year-old woman told police she heard a loud noise in her home. Then two men wearing masks, dressed in black and wearing gloves, entered her bedroom and demanded money. The victim told police she gave the suspects cash, but they then restrained her hands and feet with duct tape and searched her home for more money. They left the home and the woman still bound with the duct tape. She told police she was eventually able to free herself and call 911. The victim described the suspects as about 5 foot 5 inches tall, one with a slim build, the other with a heavy build. One of them had a handgun. If you know anything about this incident, which could help police make an arrest, you're asked to give them a call. In St. Thomas, several hours after a man's reported missing, his body is discovered on a local beach. Family members reported 62-year-old Roy Frett missing around 5 o'clock Sunday night. He was last seen taking a swim at John Brewer's Beach earlier in the afternoon. Emergency crews searched the area that night but didn't find him Sunday night. Monday morning, though, the search for Frett resumed. And around 7:15 in the morning, his body was discovered floating in the water at the eastern end of Brewer's Beach. Family members were able to identify him. His cause of death is unknown as police continue the investigation and await autopsy results. Healthcare professionals, first responders, and many who are eligible in the territory are now receiving their second dose of the COVID-19 vaccine. It means medical facilities are preparing to receive more doses and make it available for a larger portion of the community. USVI News' Ali Bourne-Vanek meets with medical professionals in St. Croix who share how the vaccination process works.
The medical team at ProHealth Urgent Care in St. Croix are completing the second round of the COVID vaccine. They're ready to move forward and serve the community.
Today I received my second dose. I feel perfectly fine. I've had no reaction. I've had no complications. I feel very well. And certainly I'm a first responder, so obviously it's very important for me to protect myself, protect you, protect the patients that I confront. And therefore I was obviously first in line, just like every other healthcare provider that has to deliver care to other patients.
Dr. John Charles Perez is the medical director for ProHealth. He took the Pfizer vaccine and reports he feels great.
We're looking at a pandemic that is not slowing down anytime soon. And I can, as being one of the first here in the Virgin Islands to receive my Pfizer vaccine, can attest that I had no symptoms, no complications, no soreness, no any type of reaction. 1. 2, just received my second vaccine today. And again, no reaction, no complication, feel like $1 million. Now, having said that, everything and anything is possible with any kind of anaphylaxis and so forth. We haven't seen it, and we've actually vaccinated several of our employees, our healthcare providers, and none of us have had any kind of reaction to date. And so therefore, what would I share with you? The same thing that the professor from USF shared with me just last week. Wherever, however, whenever you can have access to receiving your vaccine, please do.
The facility opened last March and is equipped with the refrigeration needed to store the vaccine.
We were one of the first, I guess, to receive the vaccinations. We do have our refrigeration. For Pfizer, as you know, it's different than Moderna. You have to have a certain type of refrigeration for it, a certain type of refrigerator, which we have here on island. It's actually in store right now, and so that's why we'll be able to have on hand much more doses of vaccines. We'll have our own refrigeration to store even more.
This freezer is about to be certified to hold as many COVID-19 vaccines as possible. And let me tell you, this is cold, minus 70 degrees.
Dr. Tricia Harris is the operations manager for ProHealth Urgent Care and is taking her second dose of the COVID vaccine. She shares how education is key when it comes to the vaccination and welcomes any questions patients may have.
Number one question, should I take it? Or did you take it? Or why should I take it? So that's it. I mean, I think it's more, the fear is coming from unknowing. People don't know enough about the vaccine. It's too soon. It's too quick. You know, how did it develop? What are going to be the long-term side effects? And that's probably the number one answer. What is the long-term side effects? It hasn't been enough time. It was literally created in less than 12 months. What people don't know is that 70,000 people have already been vaccinated with 2 doses just from the clinical trials alone. And so once they're educated, they have more information to know that this didn't just pop up overnight, that a lot of thought has gone into it, a lot of things through the CDC and the FDA to prepare this vaccine to give to the general public, healthcare workers, have been in the working for a while.
So far in the USVI and nationwide, the vaccine is available to first responders, healthcare workers, immunocompromised, and those over 65. Dr. Perez emphasizes that it's important to not miss the day you're supposed to take the second COVID vaccination shot.
Very, very important to follow protocol and don't break protocol. If you received your vaccine today, make sure that in 21 days you get your second vaccine. I don't care where you're at in the country. If you have to fly back to where you first started, you have to fly back. Don't break protocol. That was again reminded to me by my good professor. Do not break protocol. Make sure you receive it exactly 21 days from the first one.
In St. Croix, Ali Bornvanak, USVI News.
So 2 different coronavirus vaccines continue to roll out across the U.S. As Ali just reported, the Virgin Islands continues to vaccinate frontline workers in those in nursing homes and in high-risk groups. But as millions of Americans get their vaccinations over the coming months, it's important to note that anyone who receives a vaccination could still end up getting sick. Here's why in today's Health Minute.
COVID-19 vaccines are becoming available to more Americans.
I would strongly encourage that we move forward with giving states the opportunity to be more expansive in who they can give the vaccine to, particularly as more supplies become available.
Health officials continue to say being vaccinated is one of the best ways to protect yourself and others from getting sick. But no vaccine works 100% of the time. During trials, the current authorized vaccines were shown to be about 95% effective, which means some who were vaccinated became symptomatic. Here's why. It takes time to build immunity, and both authorized vaccines require 2 doses given several weeks apart to train the body's immune system. But people can be exposed to the coronavirus right before being vaccinated or right after, which doesn't give the body enough time to develop its defenses. The CDC says building immunity typically takes a few weeks. Moderna measured its 95% vaccine efficacy starting 14 days after the second dose, while Pfizer started 7 days after the second dose. But let's be clear, the current coronavirus vaccines cannot infect anyone with the virus. They don't contain the virus, but the CDC says vaccinated people should still use all the tools available to us. Wear a mask, stay 6 feet away from others, and wash your hands. For Health Minute, I'm Mandy Gaither.
Some very good advice there. Well, President-elect Joe Biden received his second dose of Pfizer's COVID-19 vaccine. The president-elect is hoping to boost confidence in the vaccine and is pledging to get injections into the arms of Americans as quickly as possible. He also repeated his call for action against those rioters who breached the U.S. Capitol, saying they should be held accountable.